Thank you everyone for joining us this evening for our April Spirit of Women virtual event. Today we are joined by Dr. Nina Miller and Dr. Todd Twitchell to understand the importance of your oral health care routine and how it can have an impact on your overall well-being. It's important for us to hear the steps we should be taking to keep us and our families safe when visiting the dentist office. In addition, they'll also be touching on when children should start seeing a dentist. As a reminder, we have a Q&A available on the right-hand side of your screen. Feel free to submit any questions throughout the presentation and we'll have them answered for you at the end. Now, with that being said, I'll hand it over to Dr. Miller.
Hello, welcome, and thank you for joining us today. We're going to be covering a couple of different topics, so we'll kind of get started with some of the basics. Prevention is probably one of the most important things when it comes to your oral health. A lot of cavities are not felt at the early stages. You probably won't have any pain until those cavities start to get bigger or even the nerve in the tooth gets involved. And periodontal disease is something that can't be reversed, but in early stages we can prevent it from progressing, and this is why it's really important to come regularly to the dentist. One of the most important things you can do is to brush after eating. Ideally, we would brush after every meal, but we want to make sure that you're brushing at least twice a day in the morning and before bed for 2 minutes, taking care to make sure that you're brushing all of the teeth, and especially at the gum line. We'd like you to angle your toothbrush at about a 45-degree angle, so when you're brushing right at the gum line and even under the gum line. It's really important when you're doing this to use a soft or extra soft toothbrush. Toothbrushes that are medium or hard can actually cause some damage to your gums and wear away at the teeth. The most important thing in terms of preventing cavities is using a toothpaste that has fluoride in it. This fluoride actually helps prevent the cavities by strengthening the enamel, which is the outer surface of your teeth. If you're someone that has very sensitive teeth, you can try something like a sensitive toothpaste. It's really important when using this type of toothpaste to make sure that it stays on your teeth as long as possible. So we like to recommend spitting and not rinsing with water after using this toothpaste. Ideally, you would do this right before you go to bed. That way that toothpaste can sit on your teeth overnight. If you're using a whitening toothpaste, this is perfectly safe and it's a great way to brighten your smile, but it can lead to some tooth sensitivity. And if that's something that you're experiencing, we recommend maybe stopping using that whitening toothpaste, switching to a regular fluoride toothpaste or one for sensitive teeth. It's also very important to floss. Your toothbrush bristles have a really hard time getting in between the teeth, and many cavities do start in between the teeth. So taking care to floss and hug each tooth with that floss, make sure that you get clean in between those teeth and prevent the cavities from starting there. And if you've ever noticed a white coating or a yellowish coating on your tongue, or that you have some bad breath, it could be coming from your tongue. It's okay to brush your tongue with your toothbrush, but we actually recommend using something called a tongue scraper. It can be a little bit easier to use and be more effective in removing the bacteria that are on your tongue. This bacteria is actually what causes that coating on the tongue and leads to most of the bad breath that is felt. Now, talking about how cavities form, everyone has bacteria in their mouth. The bacteria convert the sugars and carbohydrates from the foods and drinks that we put in our mouth, and they make that into acids. These acids will actually demineralize or break down the outer layer of your teeth, which is what leads to cavities. After eating or drinking something with sugar or carbohydrates in it, the pH in your mouth, the acidity, your mouth becomes more acidic, and it takes about 30 minutes for your saliva to actually bring that acidity back to a normal range where the cavities aren't forming. So if you're someone who snacks a lot throughout the day or sips on juices or sodas, this is almost like having a constant acid attack on your teeth. Since it takes about 30 minutes for your mouth to recover, if you're taking a sip every 20 to 30 minutes, it's almost like your mouth is at a constant level of acidity, which makes it much more likely that cavities will form and that you'll have trouble with your teeth. That's why we don't like you to sip on anything but water throughout the day. We want to give your mouth time to recover and make it less likely that cavities will form. Periodontal disease is actually a chronic inflammatory condition, and it causes destruction of the tissues and the bone that support your teeth. Gingivitis is a reversible form. So this can be something that you might notice if you have swollen gums, if you notice that your gums are more likely to bleed when you're brushing and flossing. These are signs that you might have gingivitis and angry and inflamed gums. The good news is that this is totally reversible. So if you start really taking care of your oral hygiene, brushing twice a day and flossing, you'll notice that you're probably going to have those bloody gums at first. But the good news is after about 2 weeks of a steady oral hygiene routine, the inflammation will be much less severe and you'll notice a lot less bleeding. So it does take a little bit of time. And if you're just getting back into a good oral hygiene routine and you're noticing the blood, don't be super alarmed. It just takes a little bit of time, okay? Now, the gingivitis can actually develop into periodontitis, and this is an irreversible destruction of the tissue. This can lead to bone loss, cause your teeth to get loose, and even lead to loss of teeth. So since it's not reversible, we really want to focus on stopping the progression. And again, I want to pitch, come see your dentist. Periodontal disease is actually connected to the rest of your mouth. So your mouth health is connected to the whole rest of your body health. And there are risk factors that are associated with periodontal disease that are found more likely to be associated with heart attack and stroke. If you're a diabetic, this is also a risk factor for gingivitis and periodontitis. And studies have shown that if you're taking really good care of your periodontal health, you're more likely to have better control of your diabetes as well. If you are able to reduce the inflammation from the periodontal or oral tissues, this can help reduce some of the inflammatory mediators that work with your diabetes and insulin resistance to actually help improve your glycemic control and help keep your diabetes under control better. There's also been evidence that shows that oral infections can cause pregnancy complications, like low birth weight, premature birth, and even miscarriage. The oral bacteria in your mouth can actually affect the fetus and trigger an inflammatory response, which can stress the fetus. So that's something that we really want to avoid.
Well, thank you, Dr. Miller, for doing such a good job explaining why we'd like you to come see us. And I would like to take a few minutes to explain what we've done during COVID to make sure that it's safe for you to come into the dental office. And if any of you have had the opportunity to come in to see your physician or the hospital, you know it's all about screening. We have all the questions and we'll be taking temperatures and doing everything to screen that you're healthy to come into the office. We're doing screening of all of the providers in our office, staff members, everyone in our dental office is screened daily before we come into the office. We've also done a lot of things differently than it was before COVID changed us and the way that we practice. We're wearing masks that are much more impervious to the virus, and we're wearing face shields to prevent the splatter that we naturally cause when we're squirting water in people's mouths, gowns that are more impervious to the moisture, all of these things that prevent us from being affected by COVID and naturally making sure that we can't transmit it to you. We're doing a lot more cleaning of all of the rooms surrounding materials have been put away into cabinets so that things aren't being exposed to that splatter, and that we're disinfecting those things that are still outside in the room that could be exposed. All of this takes more time. It takes a little longer to make sure everything is cleaned thoroughly before each patient comes into the operatory. And for that reason, we're asking, and also to help prevent the transmission even in our reception and waiting rooms, that we're trying to limit the amount of people in the reception area and the time that you're spending there. So we've worked out more ways of keeping people notified from the car, using cell phones and so forth, to limit that time frame in the reception area. We can, when we're ready, bring people into the operatories, our dental office, where we do treatment so that people aren't in the reception area as long there also. One more thing that we've done in our office is we've installed HEPA filters that are actually filtrating the air in each and every operatory where each chair is that we're treating patients in, and that turns that air filtration around in about 20 minutes. So we've got a completely sanitized environment in our dental offices now. I'd like to go from that topic to some of the topics that involve more about prenatal care, which Dr. Miller did touch on, but how this dentistry and the oral health affect infants and in the prenatal conditions. Naturally, the health of the mother is extremely important, and as Dr. Miller said, if the mouth is healthy, that affects how the body manages the stress and limiting the inflammatory types of problems that can affect the fetus. There's also the condition that most people aren't realizing: babies are not born with the bacteria that causes dental decay. It's something that is transmitted either from other family members, and anytime that we swap with a spoon or licking ice cream cones and things like that, we may actually, if we have the bacteria in our mouths, that we have active decay as adults or siblings, then that is the way that the infant can get the bacteria that will cause the dental caries in their mouth. So we recommend not share spoons and wash the pacifiers before giving it back to the baby, and all of the things that we can do to prevent that transmission. Obviously, it's not easy with siblings in the household. That's why it's important to get everybody into the dental office, get them checked out, take care of that decay so that bacteria is not at a high level that will then be more easily transmitted to the infant. We recommend having the baby come into the office from the age of 1, which is usually about the time the first tooth comes in. You can, using a washcloth, you can keep the baby's gums clean before the teeth come in, but at the age where those teeth will start to erupt, you want to then start brushing the teeth, and preferably with a fluoride toothpaste. Because we know that infants don't have the ability to spit and they're going to swallow the toothpaste, we don't want you to put an entire swab of this stuff on the brush like you see on the box and in the commercials. It's a matter from the age of 1 till about the age of 3, we recommend what we call just a smear amount. You just dab the toothbrush lightly over the top of the toothpaste without really squirting it on in any quantity at all. And that's less than a pea-sized amount that we would switch to when the baby or when the child is of the age of about 3. But the fluoride can be applied to the teeth safely, even if the child is swallowing. That small amount will do no harm, and it will mineralize and strengthen those teeth so that they're more resistant to decay from the moment the teeth start erupting. That's when they are most vulnerable, and we can prevent the decay from getting any kind of a start by using the fluoride toothpaste from the age of 1 and on up. These what's called, baby safe toothpastes. They're marketed, but using the correct amount as we've described is entirely safe. I mentioned having the child seen at the age of 1, and that's obviously just a quick exam. We actually spend more time often talking with the parent about, again, how to keep the teeth clean, talking about diet and ways to minimize the risk of decay and other tooth problems in the mouth. We're looking also at the soft tissues at that initial exam and making sure that everything is healthy for the health of the gums and the attachments of the tongues and lips and so forth. But it's also a good chance to just let the child become comfortable with us in the dental office before they need any kind of dental treatment. Age of 1, the exam can be kind of stressful for the child, but very quickly, if they're seeing us every 6 months for those cleanings, they get used to that, exam, and then the process, if anything else ever needs to be done, is just a whole lot easier on the child. So we're going to discuss the risks of trauma and other sorts of problems with the child, and how to manage any problems with the baby teeth.
So children are very active, they're very prone to falling, and when baby teeth are involved, the most common form of trauma is when a child falls and bumps a tooth. We have a lot of parents call and ask, say, my child's tooth is starting to turn a color, what should I do? Now, typically, when the tooth turns a color, if it's a darker color, a grayish color, or a yellowish color, this is something that we'll typically want to keep an eye on and observe. If the tooth starts to turn a pink color or a red color, that's not a great sign. That's something that we'll probably want to take a closer look at and do some sort of treatment. That's a sign that there's something going on with the nerve inside that tooth. And if you ever notice a bubble or a little lump that forms on the gums above the tooth that's been traumatized or has turned a color, that is also another sign that we want to see that child right away in the office to take a look, hopefully take an x-ray and do some sort of treatment to help that child. Even a very slight fall, bump, or trauma can cause the nerve and the tooth to die, could eventually result in loss of that tooth. So it's something that we really want to keep a close eye on, watch for any changes, and see how that tooth progresses, see how that child does. It's really, like Dr. Twitchell said, it's really important to get the child in for regular visits starting at the age of 1. When a child comes in after an accident or a fall or for some sort of emergency visit, oftentimes if that's their first visit to the dentist, that can make a very bad impression. But if they're already comfortable with coming to the dentist, seeing us, it's a lot easier for the child for that appointment when we actually have to do treatment. It's a lot less traumatizing and makes them comfortable for the remainder of their life. Now, permanent teeth can potentially become damaged if baby teeth become damaged, so baby teeth are still very important. We want to prevent cavities and we want to take care of them if they do get hurt. Baby teeth are also very, very important to maintain so they can hold the space for the adult teeth. If a baby tooth is lost too soon, some of those teeth could start to move, could start to shift, and make it hard for the adult tooth to erupt into place. So that is also another reason that we really want to make sure that we hold on to those baby teeth until it's time for them to come out.
Great. With that being said, we do have a couple questions that have come through, so we'll go ahead and get started on those. I think Dr. Miller, you spoke on it just briefly, but when do baby teeth typically fall out? At what age is the typical age for children?
So usually baby teeth start to fall out around the age of 6, but depending on the tooth, some of those baby teeth can last until children are almost teenagers, and we see patients that are 13 that still have a baby tooth, and that's something that can be very normal. Children develop and lose teeth and get teeth at very different ages.
Okay, great. Another is, what is tooth sensitivity and how do I know if I have it?
Obviously, you're going to feel the discomfort is usually noticed mostly with colder things, or maybe the touch of the bristles of your toothbrush on the tooth. So that sensitivity shouldn't be a lingering pain, though. It should be something that, like, you notice with the first contact of the cold or of the brush, but goes away immediately when that's removed. Those kinds of problems are often very easily treated with a toothpaste that has ingredients in it to decrease the sensitivity. Fluoride is actually a very good way to treat that, but there are other desensitizing toothpastes that have another ingredient that is absorbed on the tooth and decreases the sensitivity. If that's not effective, or if the discomfort from those kinds of things is lasting longer, then we definitely recommend coming in to see us and have things checked out. It can be a sign of decay, and so we want to make sure that the teeth are healthy otherwise. Whitening toothpastes, as we have mentioned, are something that can make the teeth more sensitive. And often people that are doing active whitening of the teeth will find that their teeth may become too sensitive to be comfortable and tolerable, and actually have to take a break from that whitening for a while. And again, you can then use something like a desensitizing toothpaste to make them more comfortable again.
So with that being said, how can you improve the whiteness of your teeth and prevent any of the sensitivity or any of that? Because there's so many things out there in the industry that they're trying to sell to whiten your teeth, but I don't think they're always the greatest things for individuals. So what do you both recommend when it comes to trying to improve the whiteness of our teeth?
I typically always recommend trying something over the counter first. So if you've tried the whitening toothpaste and it wasn't maybe quite enough for you, or maybe you didn't see the results as quickly as you hoped, I like to recommend like something like a Crest White Strip, or really any other brand. I think that they take a little bit of time to work. You have to be diligent about applying it, but I think that those are results that are well worth it, and typically are not going to cause too much sensitivity. Like Dr. Twitchell mentioned, if you do get sensitivity, take a break from it. It doesn't last forever. It's usually very temporary.
Great. How often should individuals use mouthwash? Is it regularly, every other day? What are your thoughts?
Every day with it. Mouthwash is fine. You have to be careful that some mouthwashes that are have a more drying effect on the mouth, some that have an alcohol type of a base, they do kill the bacteria very effectively. But if you're also someone that takes medications or experiences dry mouth caused by medications and other things, I would recommend mouthwashes that are not alcohol based. And there are products like Biotene that are brands that are over the counter that actually have more of a lubricating effect, and those mouthwashes won't dry the mouth and actually improve the lubrication in the mouth to eliminate that dry feeling.
Great. I think we have another question that come in. So again, if you have any questions, feel free to put it in the chat box here. What other health conditions do you guys typically see in your patients that you help detect during the typical oral health exams?
I would say the dry mouth is actually one of the things that I've noticed most often, frequently in patients, and not everyone has maybe realized that, or they're not aware of ways to treat it. And we sometimes then make a referral to physicians or someone to evaluate what is the cause of the dryness in the mouth, color of gum tissues, lesions in the mouth that can form for many different reasons. We often refer to oral surgeons to have those types of things evaluated, or our ENT, your nose and throat doctors, or the general physician, depending on the appearance of things, but those are more common. Our discussions with patients sometimes do, though, bring about a diagnosis after referral, obviously, but we can detect the chances that somebody may be having problems with diabetes and other systemic diseases.
One that was really not related to the mouth at all, but we tend to take your blood pressure at every visit, especially if we're going to be using an anesthetic. So if you are someone that's coming to the dentist regularly and we notice that your blood pressure tends to be high every time you come visit, and that's a pattern, we like to recommend that maybe you see your doctor, get your blood pressure checked out, because that can be something that you might not realize you have high blood pressure. But once we kind of establish that pattern and see that happens a lot, that's something that we'll reach out to your doctor, let them know this is what we're noticing, and have that checked out.
Great. And those are all the questions that have come through or was submitted ahead of time. So with that being said, we appreciate both of your guys' time this evening. We thank you all the viewers for joining us, and we look forward to seeing you guys in May. Take care, everyone. Have a good evening.